A person's BMI has been used as a standard health assessment for many years. However, it is now being criticized quite often as not really speaking about what the health of a person is. Many in the medical profession consider this way of determining body health to be an oversimplification of what healthy really is. The body mass index was originally developed to quickly assess the obesity rate in individuals. The really quizzical aspect of this is that the Belgian mathematician who developed the BMI had also stated that although it was a good way of studying the population overall, it was not an ideal way of studying the health of an individual. The body mass index is determined by dividing the weight by the person's height. Is it a good indicator of health? Now, it is obvious that this can give a quick view of a person's health, but in terms of race and genetics, muscle mass, and bone density, can this method be relied on to accurately determine the risk of health? Although there is much controversy over the method, it is true that poor health does increase in the underweight or the obese, severely obese, and extremely obese classes. At these times, it may be recommended to change some aspects of one's life, such as diet and increased exercise, even with the amount of criticism as to the simplicity of health determination. Many health providers still support the ability the BMI reading gives them to determine a person's risk of serious health issues. This does not make the BMI a foolproof method, however. There are other factors that should be taken into consideration when determining how accurate the body mass index is, in regards to foretelling health. Other aspects that are not taken into consideration include age, sex, race, lifestyle, medical history, genetics. The downside of BMI. Another set of factors that the BMI does not give an accurate view of is blood pressure, cholesterol levels, heart rate, blood sugar level, or inflammation levels. The same calculation is used for males and females with no regard to muscle mass. As people age, the muscle mass does diminish as the fat mass increases. Other aspects not taken into thought or consideration for the BMI chart are socioeconomic and the ability to access healthy foods, mental well-being, living conditions, and knowledge and ability to prepare foods. What this is pertaining to the most is that the lower income or even mid-income families have a more difficult time affording nutritious foods due to the increased costs of such versus sugary, fast foods and heavily processed with artificial ingredients. For the middle to lower class, it is more economical to purchase the not as healthy items as they can purchase more, enough to feed the family. Determining health risks based on BMI. When it comes to determining health risks based on BMI, you could have two people side by side, exactly the same height and weight, yet they look completely different. One may exercise more so has more muscle mass, while the other has a higher fat mass. However, based on the BMI method, they would be considered in the same health class. It is possible that the distribution of a person's fat mass may make a difference also. It is believed that those with a majority of fat mass in the stomach region are at a greater risk for poor health compared to those with the fat mass around the hips, buttocks, or thighs. Some doctors, also contributing authors to an article published in Science, have stated the need for a better method to measure fat and skeletal muscle, that these would be able to give a better look at the health risks of each individual person. BMI's biggest flaw. What is considered to be the biggest flaw when using the standard body mass index is that it does not take into effect that muscle mass weighs more than fat mass. As an example, the current BMI calculations would show that a person who sits around with no exercise and weighs 220 pounds has the same BMI as a wrestler who weighs 220 and is the same height. When looked at in this manner, it is scientifically the truth that the body mass index does not work as it should. Using this previous example, the loafer who sits around and does no exercise is just as healthy as an athlete who works out continuously. When looked at in this aspect, yes, there are serious flaws with the current BMI. Yet, the CDC and Centers for Disease Control currently state that the current body mass index calculation is a fairly reliable method of determining obesity. Maybe they should explain that to the wrestler who is now considered overly obese. The same as what we would call a couch potato. BMI for athletes and normal people. The National Health Institute also states that a good way to decide if your weight is healthy is to use the body mass index chart. Both of these health institutions might want to reconsider what they are telling people. This could be a reason why there are such issues concerning their weight for so many people. Those who are truly obese having the same BMI as a professional athlete are highly deceiving and will not benefit the couch potato who does not make an effort to be healthy. However, it could be mentally detrimental to the athlete who had believed he is healthy and in the best shape of his life to be compared as equal to the couch potato. This could lead to harmful behaviors of various eating disorders such as anorexia, bulimia, or other negative behaviors that some people turn to when they want to lose weight.
That's it for today. Check out the channel for more health and weight loss content. You can also purchase our weight loss course. And please, like and subscribe to be notified of our next tip. See you next time.